Can I come in? Hi, my name is Julia. I'm a student nurse from Oakland University, and today I'm going to be performing a wound dressing change as well as a wound assessment on you. It should take about 15 minutes. Is that all right? Okay, great. What is your name today? Helen Baker. Okay, I'm just going to move back your blanket and check your wristband. Okay, and then can you tell me your birthday? Okay, perfect. So now I'm going to close the curtain and administer privacy and perform hand hygiene. I'm going to raise your bed up to waist level, put down the railing, and then are you positioned comfortably? Okay, fantastic. So I just want to explain to you what's going on today. I'm going to be removing your old dressings, disposing of them in a biohazard bag, cleaning and assessing your wound, and then putting on all of the gauze and the old dressing or the new dressings. And then I'll set you up with your call and you'll be good to go for the day. Does that sound okay? Okay, great. So I have my flat surface. I have my supplies that I've gathered. I'm going to inspect my wound care tray here. The seal is intact. There are no rips and tears. It is not wet. The expiration date is January 31st, 2022. So I know that this is good to go. I'm setting this down. I'm going to grab from the base of the wound care tray and pull it open from the corner and then tuck it underneath. I'm going to take out one pair of gloves, set them off to the side, and then take out another pair of gloves carefully. I'm facing the cuff end towards me, pulling it open from the corner and then pulling the inch barriers open. Now I'm going to take with my non-dominant hand, I'm going to grab the fold of the cuff, and then I'm going to tuck my thumb underneath, push it into the glove, and then pull my hands into the glove while it's facing upwards. And then after that, I'm not going to touch my cuff anymore. So next I'm going to take my 4 fingers, put them into the other cuff of the other glove. I'm going to put my hand in, and then once my 4 fingers are in, I'm tilting it upwards to pull my hand in. I'm not touching my cuffs anymore. Now I'm going to grab from the center of the bag, careful not to let the corners of the bag touch me, and I'm going to dispose of it. So if in real life, if this paper were to touch my gloves, I would start all over and get new sterile gloves. And then I'm disposing of this off to the side. So now that I have on my sterile gloves, I'm going to grab the sterile towel and step back. I am opening this carefully so that it does not touch me. And then I'm keeping it open halfway, keeping it above waist level. And then I'm draping it out towards the table and letting it go before it touches the table. I'm adjusting it from the center. So now the next thing I'm going to do is remove the objects from my wound care tray. So I'm stepping over, grabbing them, careful to only touch the inside of the wound care tray, grabbing, setting them down. Again, grabbing as many things as I can, setting them down. Setting things down. So now that my sterile field is set up, I'm going to grab the biohazard bag and step back. I want to open it carefully so it doesn't touch anything except my gloves. Then I'm going to put the bag next to the patient. In real life, I would not put the bag on the patient, but we are for the sake of this validation. So I'm setting the bag down, careful to keep myself facing my sterile field. So now I'm going to remove the old wound dressing. So I'm going to go from outermost to innermost around the edges, pulling down on the skin so that I keep the skin intact. And I'm disposing of that, careful not to touch the bag. Then I'm going to take off the next layer of gauze and then the innermost layer of gauze, and then disposing of that. If the gauze was dry and stuck to the patient, I would use normal saline to moisten it and then remove it that way so that I don't tear the skin or damage the wound any further. So I looked at the old wound dressings and I noticed that there's scant serosanguinous drainage that is a pale red color and has a thin consistency, and there is no odor to that drainage. So now I'm looking at my wound. It is secondary in tension and it needs cleansing. The edges are not approximated. So at this point, my gloves are no longer sterile, so I would wash my hands, get new gloves on. So now I'm going to take my 4x4 gauze. I'm going to take about half of it And then I'm going to take my saline, dump it into the wound care tray, and then I'm going to take the gauze and then get it wet in the wound care tray. Now I'm going to take one piece of gauze, wring it out, and then I'm going to clean the wound, still facing my sterile field, in the center, then dispose of it. The left side, and then dispose of it. And then the right side, and then dispose of it. Looking at my wound, I see that it is pink. There is granulation. Again, the edges are not approximated. I see some serosanguinous drainage that is a pale red color. There is little of it. Most of it I got off while I was cleansing the wound. And there is no odor. So now that the wound is cleansed, I'm going to begin packing it. So I'm taking a moistened towelette, the 4x4 gauze, wringing it out, and then I am gently packing it into the wound, careful to not have any of the moistened towel on the rest of the skin that's intact. Then I'm going to take dry gauze and place it over the wound. And then next I'm going to take the pad. With the blue side facing up, I'm going to place it over the wound. Then I'm going to grab my tape. I'm going to pull it open, and I'm going to tape the wound. Careful because the wound is, because the tape sticks to gloves. So I'm taping it on all 4 sides, making sure that the patient is okay, and being gentle with the center of the wound. So now that I have taped down all 4 sides, I'm going to dispose of the tape roll in the biohazard bag that is still sitting upright with all of the containers, the things inside of it. I am going to take my label. Oh, one thing that I forgot that I would normally do, after I cleansed out my wound, I would assess if there was any necrotic tissue or any slough. In this case, there was not. And then I would also then measure the wound. When I would measure the wound, I would measure the diameter, the width, and then I would look and do the depth. So for example, 3 by 3 by 2 centimeters deep. And then I would set that aside. So now that the wound is all taped up, I am going to grab my label, and I am going to initial and date the wound. So I'm putting my initials, I'm dating it, and then I'm going to stick it to the corner of the pad. So the next thing I'm going to do is I'm going to take all of my objects. I would dispose of them all in the biohazard bag, and then take that. I would take off my gloves. So to do that, I would grab from the center, pull up, ball it up, slip my hands underneath, and then take off my gloves that way, and then I would dispose of those as well. Then I would ask the patient if they were comfortable, raise back up the bed. I would raise the railing, and then I would raise the patient to their comfort, and then I would ask them, what's your pain on a scale of 1 to 10? Okay, 3, perfect. Obviously we want that to be as low as possible. I'd make sure they have their call light, and then I would exit the patient's room. Thank you.